morning, everyone. This is the video describing step-back technique of cleaning and shaping of root canal systems. The major objective of the root canal treatment procedure is to remove the contents of the pulse space and shape the walls of the canal to receive the filling material. The objectives can be divided into mechanical objectives and biological objectives. As far as Schilder's 5 mechanical objectives are concerned, they direct to develop a continuously tapering conical form in the root canal preparation, make the canal narrower apically with the narrowest cross-sectional diameter at its terminus, make the preparation in multiple planes, never transport the foramen, and keep the apical foramen as small as is practical. The biological objectives are to completely debride the pulp space from pulp tissue, bacteria and microorganisms, dentinal debris, and endotoxins. The techniques of pulp space preparation can be apical to coronal, coronal to apical, or hybrid. We are studying the step-back preparation in this video, which is an apical to coronal technique of pulp space preparation. The shaping of root canal can be understood in 5 phases. Phase 1 would be to negotiate the canal. Then we move on to coronally pre-enlarging the canal, establishing the working length measurement, root canal shaping techniques, and then root canal working with establishment. The step-back technique, also called as the telescopic technique, was given by Clem and Wien. And Mullany described this technique as particularly effective in fine canals. He divided the step-back preparation in 2 phases, the phase 1 and phase 2. In phase 1 preparation, the apical preparation starting at the apical constriction, and phase 2 is the preparation of the remainder of the canal. Gradually stepping back while increasing the instrument size. So first, we start with the phase 1, where the apical preparation up to file 25 master apical file is taken up to the full working length with recapitulation using prior file sizes. So the step-back technique, also the telescopic technique, relies on reduction of working length for larger files, typically in 1 or 0.5 mm steps, resulting in flared shapes of 0.05 and 0.1 taper respectively. Incrementally reducing the working length for larger and stiffer instruments results in lesser aberrations. So we start with a 10K file, take up to the working length, and measure the working length. We note down our measured working length. And continue with our preparation. We'll file the canal till we feel that this particular file is loose in the canal. So we continue shaping it till we can feel little to no resistance to this file, particular file, that is we are using 10K right now up to the working length. And we continue doing it till we feel that this has become loose in the canal. As for irrigation, this is our common 25 gauge open-ended needle which we get with our syringes. Now, if we use this needle for irrigation, the maximum this can do is to clean the coronal portion of the root canal. However, if we use finer needles like this 30 gauge needle, these are side vented needles. These are not open-ended. So the chances of apical extrusion becomes very less. You can see the side vent. So also because of the fine gauge, we can reach up to the apical thirds of the canal much more easily than as compared to our regular 25 gauge needles. So for endodontic irrigation, these needles are recommended. Next, we move on to a 15K file, measure it back to the working length, and continue preparing the canal. Again, we will file the canal till we feel little to no resistance, and we can feel that the file has become loose in the canal. Then we move on to the subsequent file, that is the 20K. Measure it up to the working length and again continue to shape the canal. This process of step back preparation, we will continue with increasing the incremental sizes up to 25K or 30K, and we'll take it up to the whole working length, meanwhile irrigating it. And you can see the 30 gauge file is not able to reach up to the apical third yet, but it is very close to it. So we are able to clean the apical debris while ensuring that none of the irrigant comes out from the apical foramen. Cleaning the root canal while maintaining that there is no extrusion from the foramen. Then we move to 25K file. We'll pre-curve this as this file is comparatively stiffer and our canal is curved. Most of the canals are curved, so we pre-curve the file before going into the canal to avoid shifting our apical foramen to avoid transportation. And then we move on to shape the canal up to its working length. We are still in phase 1 of our step back preparation, where we are preparing our canal up to the full working length with incremental sizes. It's important that irrigation is used after each step because the fibrous pulp stumps may be compacted against the apical constriction and cause apical blockage. Also, recapitulation is important with previous smaller size instruments and carried to full depth. Then in phase 2, we move stepping back procedure is employed in 1 mm or 0.5 mm increments while recapitulation with the 25 number file till full working length. So now we move up to a 30K file, pre-curve it, measure it up to 1 mm shorter than the working length and file the canal till it is loose. Then we'll do similarly with a 35K file. We'll again shorten up by 1 mm or 0.5 mm, then prepare the canal till it is loose while maintaining irrigation and recapitulating it with 25K file. Irrigation and recapitulation has to be kept in mind, which is very important to ensure that there is no apical debris collection at the apical third, and then recapitulating it again up to the full working length to maintain the patency of the canal. Then we move on to a 40K file. Again, reduce the length by about 1 mm or 0.5 mm, continue shaping it. Again, irrigate and recapitulate. These are the two steps which always should be remembered while shaping any canal: irrigation and recapitulation. So now you can see that the root canal is done up to phase 2, where we have prepared the canal in step back preparation with enlarged files, and we irrigate it to ensure that the canal is clean, and we move on to our phase 2, which is the refinement phase, where we will use gate gidding drills number 2, 3, 4 to create coronal and middle preparations. We are using GG2 to prepare our middle and coronal thirds, ensuring a telescopic preparation. Again, we will ensure recapitulation and irrigation, which is a must between any sequential filing. With a 30 gauge side vented needle, we do that and recapitulate. After we are done with the GG preparation, we return to the last master apical file short of working length to smooth the step back with vertical push strokes, and circumferential filing is done with an H file. The final preparation should be an exact replica of the original canal configuration, except that it would be much wider. You can see this is our final canal preparation, and we will further finish it with a circumferential filing with our master apical file number and H file. So in push-pull strokes, we circumferentially file it, irrigate it, and we are done with the preparation. The final form with a smooth taper, and the advantages of this technique is there is better tactile awareness. It keeps the apical preparation small in its original position with gradual taper, ability to prepare proper apical stop, and it avoids zipping. The disadvantage are chances of pushing debris into periradicular tissues. The working length is likely to change as canal curvatures are eliminated. The objectives of cleaning and shaping have to be kept in mind while using any type of cleaning and shaping procedure. That is, you have to remove the infected soft and hard tissue. You have to give disinfected irrigants access to the apical canal space. You create space for the delivery of medicaments and subsequent obturation, and you retain the integrity of the radicular structures. Thank you for watching this video.